Hello? It was. Good morning. Good morning, everybody. Thank you for coming, and let me talk about today our GNU Health project in the context of integrative and precision medicine. The first thing, let's talk what is GNU Health all about. GNU Health is a free software project that deals with these four functional levels. First one has to do with the person and the community. Okay, so how people live, what are the domiciliary units, lifestyles, and so on. We are talking here about people before patients. Here is healthy community. We are not talking about patients, we are talking about people. The second level has to do with dealing with patients. So we move one step forward, and now we're dealing with the medical community. Okay? So there you have the medical records, you have hospitalizations, surgeries, genetic info, and so on. Once we have those two levels in place, we move to dealing with the health institution itself. Okay? What do we do with our finances? What do we do with pharmacies, stock management, human resources, and so on? And finally, we need to make that data that we've been collecting in this transactional system meaningful. So we pass from transaction to analytics, and that's the health information system part of it. As I said, GNU Health is a free software, free as freedom, meaning you can download the system, you can customize it for your needs, you can get feedback to the community, and finally you can improve it. That is the power of the free software itself. Here are some components of GNU Health. All of them must be free software in order to make sense out of it. So getting in the context of precision medicine and integrative medicine, we come from the social medicine part. We come from public health. And we go around the world in different countries checking what is the status of the public health systems around the world. And we have this dilemma on whether it's nature or nurture, what is actually making the difference between me being healthy or me being sick. And we took the approach of integrating the two things. Today we're dealing on the system of disease. Okay, so pretty much all country systems of health deal with sick people. You deal with only the reductionist part of biology and trying to cure those sick people. But there is not that much being done in terms of prevention and health promotion. What we try to do is moving also in the system of health. So here we have the impact on what the environment has to do with you. These two mice that you see there are, from the genetical point of view, identical. Yet one is obese, it has propensity to cancer, diabetes, etc., and the other is very healthy. And what is most important out of it is that their offsprings will be also healthy. And we haven't touched and we haven't changed the genome from any of them. So it's the environment actually what is changing, or in our case, our lifestyle or our environment, what it will make you sick or healthy, right? So this is the Agouti sisters. That is probably one of the most dramatic examples that we have today in the epigenetics field. Another case that is closer to humans has to do with the tuberculosis example. Okay. In tuberculosis, we know that 1/3 of the population of the world is infected with Mycobacterium. but who actually gets sick out of it, who actually develops the clinical signs of tuberculosis. Well, we're talking about those that don't eat well, those who live on overcrowded conditions, you know, those who don't have enough nutrition and social backend to be healthy individuals. Dr. Caminera, who is one of the best researchers on tuberculosis, calls it the epidemics of injustice. And here it's from the Canadian health, public health system, we see that 50% of our determinants of health come from socioeconomics. You know, genetics and biology is important, but only accounts for what, 15%? You know, the physical environment and so on. So it's great to focus on the molecular basis of health and disease, but we cannot just take that as the only factor that we have in our health. There is a lot of hype today on the molecular basis. I think it's great. I think it's very important. But if we just focus on that, we are going to keep on reproducing the system of disease that we talked at the beginning. We have to have this holistic picture of the human being. Okay? So biology is very important. We do embrace biology, but we also embrace all the other socioeconomic factors that make that person unique. So when we talk about precision medicine, we should be talking about precisely which individual do I have in front, not just the molecular basis of that specific disease or protein or gene at the end of the day, but the whole holistic environment that is going to make us healthy or unhealthy. Family functioning, housing condition, working condition, all of those are as important as our genetic load. Again, WHO has a whole list. Canadian System of Health has enhanced it, and all of these conditions is present on NuHealth. So when we are taking an assessment of somebody, all of these indicators are going to be present, not only for me as an individual or as a physician, but also for the Ministry of Health, that is going to have this general idea of the individual, the family, and those are the conformants of the society. So what do we actually take in consideration? Well, we already saw the socioeconomic determinants, but now also you are going to have the medical information, family history, clinical history, surgeries, obstetrics, and so on. In terms of genetics, you also have a whole list of natural variants of proteins coming, in this case, from the UniProt project, that allows us to identify what are those mutations and what are the phenotypical traits that we might see in that specific individual. So not only we have that database, but also all the links related to MIM and so on. And we use a concept, especially in this new version, that has to do with the concept of life. Our life is much more than just clinical records. I like to see our life like a compendium of pages of relevant events that happen in our life. Not necessarily they have to be medical. They can be demographics, they can be biographics, they can be medical, and they also can be social. So depending on the context, you are going to be writing one individual page of life on these relevant main categories. And here are some examples of it. When you take one type of page, depending on the type of page you have, you will have different contexts In social, you will have social exclusion, the social gradient, stress, lifestyle, and so on. In medical, well, all that has to do with the medical context, whether it's a health condition, whether it's a patient evaluation, lab, imaging, prescription, and so on. It has to be easy to write and read, not only by the health professional, but also for the patient. This is not just about having the patient as some passive actor in the system of health. We want to empower the person to be part of her health or his health also. So by having this kind of romantic idea of the clinical record, calling it the book of life, is really going to empower and put the patient and the person on the driver's seat. So if we take an example of the BRCA1, for example, this is the information that the person will have and the physician and the researcher. We are not just focusing on the molecular basis of it, which is very important, of course, but we are also focusing on the lifestyle, the family history, the socioeconomic conditions of that specific person. And then I have a whole idea of what I have in front. If I just focus on the molecular basis and I don't have the whole picture in front of me, I'm missing a lot of information. And what do we do with this? Well, you have the possibility of sending and sharing this information on the federation. And when you share the information on the federation, now you are allowing researchers to also work on some mutations that had to do or are not clearly pathogenic, of unknown significance. And what do we do with those mutations or those natural variants that we don't really know what is going to be the implication of health of a person? Well, that's the idea of having these large databases that we can all see what's going on, not only at regional level, but also at country level and worldwide, why not? So this is the federation. It's conformed of different nodes. Each node can be a person, it can be a hospital information system, it can be a lab, it can be related to social management, and each node is autonomous. They can work independently. They don't need to have a network in place. All the information collected from there can be later on sent to the Federation Health Information System. But if you don't have internet, that's the case in many countries in this world, you can keep that information until the link is up, and then you will be able to synchronize that information to the Federation. So one of the issues that we have today is that most databases and most health systems work in isolation. We need to be able to create networks of networks. If we don't work as a community, as putting together health professional people and research institutions, we are going to keep on working on the system of disease. We need to be able to share this important data in order to improve the health of our communities. And again, not only based on the molecular basis, but also taking consideration all the family history, socioeconomic condition, lifestyles, and so on. So that is a diagram on how it would actually work in terms of connectivity, messaging server, and so on. And this is a hub that allows both practitioners and researchers to have a test bed on their institutions. Here you will have all the components. So on one side you will have the relational databases, you will have the transactional systems, But you will also have document-based databases. You will have MongoDB. You will have all that health information system ready to test and try and create your own APIs, interfaces for your own institution before you go on production. It's great for training, and again, it allows us to give feedback and improve the system itself. And this is what we want to reach, and this is what we really want to achieve. We really want to create, in all the countries that we are working today, a large worldwide international federated health network that interconnects all these institutions and the information gathered from them in order to improve the quality of health, but again, not only in terms of biology, but also in terms of health promotion and disease prevention. For that, we have the New Health Alliance that allow us to partner with different institutions, academic and research institutions. This is the impact that the academia can do on it, from Malaysia to the United States, Cuba, Argentina, Italy, whatever they are working together. Different countries that are actually using the New Health in their system of public health. Jamaica is using it country-wise. They have over 350 health institutions. And this project started, they've been using it for 5 years now. Laos, we work along WHO for different things, not only using their standards, but also in specific countries like Cameroon. Red Cross, we go from very small health institutions in the middle of the rainforest, in this case of Bikop, to quite large organizations like AIMS, that is the largest hospital in Asia, with over 1 million evaluations per year. So, it's a matter of if different health institutions and different countries get together in this federated model that we're talking, we can really make a huge difference on our community's health. And finally, let me invite you to the New HealthCon that we are going to be having in Las Palmas next week, actually, to keep on working on this concept of social medicine, because at the end, medicine, as Rolf Virchow said, it's a social science, and politics is nothing else but medicine at a large scale. And this is our goal. Our goal is to have this holistic view of a person, an individual, and how all the determinants from the molecular basis to the environment can actually shape up our health, not only as individuals, but as families and as society. So thank you for coming, and any questions that you might have, I'll be happy to answer. Thank you. Any questions? I think we are plenty of time. Yeah, we have 10 minutes. And if not, we can just discuss it on the panel there on our booth. So thank you.